Okay. Next in Jangamavishya. So we have completed so far Sarpavisha. Now we'll move on to other Jangamavishas. Okay. So main FAQ is classification of these Jangamavishas and individual classification. Sarpavisha classification, Lutra classification, Rushika classification, Kita classification, Mushika classification. So under important Visha Lakshanas and then treatment. This is the important FAQ. Okay. So here at least main question, if they ask means directly they will ask about the classification, numbers. Second level question, symptoms. Third level questions, treatment with important agadas used in a particular Visha. So you should keep three things in the mind while reading this classification of Jangma Visha. So Stavara Visha, individual Vishas and their Lakshanas and their Chikitsa. Jangama Visha, individual classification and their Lakshanas and their Chikitsa. Okay. So it's hectic to read. So no other way. We need to go with it. So first and foremost thing, try to memorize numbers. Second thing, to try to memorize important Lakshanas. So third one, important agadas and Chikitsa Upakara. So Kita Visha. So many Kitas originate from their Visha Adhisthana, Shukra, Mala, Mutra and Shava. Okay. And Swasa is in Sarpa Visha. So Kita classification. So Vataja 18, Pittaja 24, Kafaja 13, Sannipataja 12. Total number of Kitas are 67 in number according to Sushruta and Vagbata. So important is according to Vagbata, so they are predominant of Vata Pittaja Kita. So according to some other author, it is Vata Kafaja. So two difference of opinion is there in Kita Visha. Vata Pitta Kafa Pradhana idella idu Vata Kafa Pradhana. Kita Vishas are Vata Kafa Pradhana ide. So next Kita Vishas are Vata Pitta Pradhana. Vata Pitta Pradhana kind Vagbata, Vata Kafa Pradhana kind Sushruta maybe. You just go through the reference once. Okay. ಇಲ್ಲಿ ಅಗ್ನಿ ಒಂದು ಡಿಲೀಟ್ ಹಾಕ್ಬೇಕು. Once again, just take the reference. So in my knowledge, so according to Sushruta that is Vata Kafa Pradhana, according to Vagbata it is Vata Pitta Pradhana. So example kuda question ಕೇಳಿದ್ರೆ ಇದು same thing. So kitas are predominant of so and so visha, so and so dosha. Again, in sub-classification, Kanabhas are 4, Godalaka 5, Galagolaka 6, Shatapadi 8, Manduka, Pipilika, Makshika, Mashaka. So in total, they are 48 in number. So symptoms and the bite mark, Damshar, bite mark. It's like that. So here most important and commonly we will expose to Makshika. Okay, honeybee. So you know honeybee poisoning is very common. So in childhood days also many times you have a bite with honeybee. So what will be there? So that will impart its part to the body. So ನಾವೆಲ್ಲ ಮುಳ್ಳು ಅಂತ ತೆಗಿತಾ ಇದ್ವಿ. So some type of air root structure will be there. So that will after bite it will be hang to the skin. So it is a poisonous one. So the foreign body, there will be huge pain, swelling will be there in the bite area. So we need to remove that spike from the body. Then that things will be doing good. And I have seen some patients with a huge honeybee bite. They may life may be fatal. Okay, they may lead to death also if they won't take a proper care. Okay. So 5, 10, or 15. So it's okay to manage with other things, but it is more visha, more bite with makshika. So that may leads to a severe poison in the body. The person may go into die. Very careful. So somebody told that if you lay down in the surface, they won't bite. If you jump into the water, they won't come. Okay, if you keep fire in hand, they won't come. Okay, so some we don't know exactly how these things are work, but especially fire and the water definitely will save you. At least cover the whole body with cloth if these things were not available, so they won't bite you any part of the body. Okay? So lay down on the surface is the most important thing. You can lay down completely and covering the parts. They won't come and touch. So according to some experienced persons, they are telling. And in folklore, so these symptoms are kandu, shofa, daha, vedana, and the bite area. So common symptoms, kandu, shofa, daha, vedana. They are telling you to apply an antidote. Uh, we can use sunna. What we can call sunna in English? Sunna. We are using it for a bitter leaf, no? Sudavargiya Dravya. Okay. And along with turmeric. It's a calcium carbonate, I think. So along with turmeric. So both mix sunna and turmeric equal quantity and apply over the bite area. So turmeric is an antipoisonous, and this calcium carbonate, the sunna, will work on reducing the show over that area. It's also an irritant. Okay, it will reduce. In some other areas, they will practice just by putting a soda water on the affected area. The shodha and irritation will come by applying soda water. So just make, so if you put soda to the water, it becomes liquid only. So directly apply soda over the area and put 1 or 2 drops of water over there. So things will be alright. Even in Arctic area also, emergency management is this one, soda water. Okay. So nothing is available, we can use soda water. So Makshika, I should remember. Pipilika, very common. Shota, Daha, like Agni. So bite from ಯಾವುದು ಗೊದ್ದಗಳೆಲ್ಲ ಇರುತ್ತೆ ಪಿಪ್ಲಿಕಾಸ್ ಮಾವಿನ ಮರಕ್ಕೆ ಮ್ಯಾಂಗೋ ಟ್ರೀಗೆ ಏನಾರು ಹೋದ್ರೆ ಸೊ ದೇರ್ ರೆಡ್ ಪಿಪ್ಲಿಕಾಸ್ ಬರುತ್ತೆ ಸೊ ವೆರಿ ಡೇಂಜರಸ್ single bite you will remember it for a day. Red piplicas. Okay, so other shatapadi, galagolaka, kanaba, you just go through the symptoms. Here very clearly given dosha dikyata vivida vishakitas. So kita is vata pitta, mushika is kapha, kanaba is kapha. So here we can give vata pitta, ashtanga sangraha, ashtanga hridaya, charaka samhita, vata kapha, susha samhita. Correct ಅಲ್ಲ? Previous slide ನಾನು correct ಮಾಡಿದ್ನಲ್ಲ? It is correct. So vata kapha, susha samhita, vata pitta, ashtanga hridaya, ashtanga sangraha, and charaka samhita. So difference opinion is there. Mushika is kapha, kadava is kapha predominant, luta is tridosha. So rushika and uchitinga is vata predominant, ashtanga sangraha, sushruta samhita. Alarka visha is tridosha predominant, brahmara is kapha adikya. Brahmara is nothing but a makshika again. So this slide is very important. So you should remember the doshi predominance of these different jangama vishas. Okay. So without fail, you must remember the doshi predominance of these jangama vishas. Got it? So nimgadu, whenever if you wake up in the midnight, also you can able to tell the doshi predominance of so and so is very important thing and a basic thing. So ಕೆಲವೊಂದು ಬೇಸಿಕ್ಸ್ ಅಂತ ಹೇಳ್ತೀವಿ, ಬೇಸಿಕ್ಸ್ ನಿಮ್ಗೆ ಬರಲೇಬೇಕು, ಅದರಲ್ಲಿ ಏನು ನೆಗೋಸಿಯೇಷನ್ ಇಲ್ಲ. ಸೊ ನೋ ಎಕ್ಸೆಪ್ಷನ್ಸ್. ಇದು ಪ್ರೈಮರಿ ಥಿಂಗ್. ಸೆಕೆಂಡರಿ, ಟರ್ಷಿಯರಿ, ಥರ್ಡ್ ಲೆವೆಲ್, ಫೋರ್ತ್ ಲೆವೆಲ್ ಇಟ್ ಮೇ ಬಿ ಡಿಫರೆಂಟ್ ಥಿಂಗ್. ಅಟ್ ಲೀಸ್ಟ್ ಮೈನ್ thing you must ready to tell which is the dosha predominant in particular uh, Janga Purush. It may be Kita, Luta, Mushika, Sarpa, Rushchika, ಯಾವುದಾದ್ರೂ ಆಯ್ತು. So types of Kita and all classification Tikshna, Mrudu and Manda similar to Rushchika. Charaka classification is Dushi Visha and Pranahara Kita. Two types as per Sushrita, Tikshna and Manda. Dushi Visha Kita produces Pitaka, Kandu, Raga, Krishna, Aruchi, etc. Pranahara Kita produces Sarpa, Damshta, Tulya, Shofa. So it's just like the snake bite, like Shota will be appear in case of Pranahara Kita. These kitas are available. So 5 years or 7 years back, we have witnessed some deadly kitas available in Chinese forest. Because of the bite, a patient was died. So many patients was died. Uh, it's available in different areas. So not exactly things will be there, but it was in use 5 6 years back. Even lutas, some deadly lutas are available in deep forest, in deep caves. So it may be available. So, but don't know. So whatever the classification they are done according to 2,500 years back. You should imagine it is 2,500 years back. Presently, it is also available, but we don't know. Chikitsa, Pipilika, Makshika, Mashaka. So we can do external application of Krishna Valmika Mrutika and Gomutra. It's easily available. Krishna Valmika Mrutika. Uh, Valmika Mrutika is easily available everywhere, but especially here they are advising Krishna Valmika Mrutika. So Krishna Valmika is dominant of iron. Iron ಜಾಸ್ತಿ ಇರುತ್ತೆ. So ಅದರಲ್ಲನ ಮಣ್ಣು ಯೂಸ್ ಮಾಡ್ಬೋದು with ಗೋಮೂತ್ರ. You can apply over the area with ಗೋಮೂತ್ರ. Shitapachara is contraindicated in Kita Visha. For all other Vishas, Ushna Kriya is contraindicated. This is one contraindicated. You must remember these things for your lifetime. Okay? Shitapachara is contraindicated in Kita. For all other Vishas, Ushnapachara is contraindicated. So especially Svedana is contraindicated in all Visha, but it is indicated in Rushi Visha, Kita Visha, Ruchika Visha, Svedana. ಉಷ್ಣೋಪಚಾರದಲ್ಲಿ ನಿಮ್ಗೆ ಏನು ಅಂತ ನೆಕ್ಸ್ಟ್ ಕ್ವಶನ್ ಬಂತ ಅಂತಂದ್ರೆ ಎಸ್ಪೆಷಲಿ ದ ಸ್ವೇದನ. Svedana is contraindicated in all vishas, but it is indicated in Dushi Visha, Kita Visha, Rushchika Visha. ಇದನ್ನು ಬರ್ಕೊಂಡು ಇನ್ವರ್ಟೆಡ್ ಕಾಮನ್ ಬ್ರಾಕೆಟ್ ಹಾಕೊಳ್ಳಿ. So Svedana is Urdhvada Svedana and as well as Shodana also. So one question paper which is the Anupana for Dushi Vishari Agada. That was a question. Anupana is Madhu. Anupana for Dushi Vishari Agada is Madhu. ಗರವಿಷಕ್ ನಾನು ಅವತ್ತು ಹೇಳದ್ನ. ಸೊ ಟ್ರೀಟ್ಮೆಂಟ್ ಗರವಿಷ is ಸಂಯೋಗಜ ವಿಷ. Treatment you note down for ಗರವಿಷ ಚಿಕಿತ್ಸಾ. ವಮನ and ಹೃದಯ ಶೋಧನ explained in ಚರಕ ಸಂಹಿತ. ವಮನ and ಹೃದಯ ಶೋಧನ. ವಮನ and ಹೃದಯ ಶೋಧನ explained in ಚರಕ ಸಂಹಿತ. So for that Acharya told on combination Tamra Raja Madhu, Tamra Raja Madhu and Swarna of one Shana. Swarna of one Shana. Okay. And one more is Murvadi Churna is a antidote for Garavisha. Murvadi Churna. Keep it in bracket. So question paper question it answer the Murvadi Churna Garavishadalli antidote. Murvadi Churna. Nodi, Swarna is a natural antidote for Visha. Wherever you go and read, especially Garavisha. Garavisha is a poison. It may be two unpoisonous things will mix it together, it becomes a poison. Or two poisonous things, or one poison or one unpoison. So whatever may be the mixture. So the Garavisha will be having Utpatti by Samyoga. So individually there is nothing to worry, but if they have a Samyoga, that will lead to Gara. So here with our foodstuffs and all, we need to worry about so Garavishas of two non-poisonous things. Okay. So nowadays preservative Ajinomoto is a very common food taster, food preservative used everywhere. So like that, it is a kshara actually. Ajinomoto is a kshara. If you consume excess of kshara, in our classics there is a three contraindication for excess use of three things. One is Pipali, Saindava, kshara. So we should not use kshara and Pipali for longer duration. So it is a kshara. If you consume these Ajinomoto based foodstuffs regularly, those who are consume these foodstuffs in a hotels, this is very common. Okay, so in Bangalore, anywhere the taste is very good, super. If you go to that hotel every time, means definitely they will have some tasting pots. And even nowadays, in marriage functions also, they are going to use tasting powders. So to give taste to the food, but indirectly this is a kshara, so it is not good for health. Okay. So for that reason only in olden days, people used to wear a ring, gold ring, for right hand only. Because in right hand they will going to consume the food, and they advise not to remove the rings with while taking the food. It is a strict advice for everywhere. Nowadays we are wearing a small rings. Olden days they are wearing a big rings, and the purity and other things will be good. Along with they are wearing some stones, gemstones. That stones will nullify the poison effect. So like that stones also they are wearing. Even in folklore, many times they use some stone to remove snake poison. That stones also they are wearing in the hand. Especially the kings will wear the four rings or five rings or six rings to their fingers while taking the food. So the main rationality is to nullify Garavisha if it is present in the food. Okay. The concept is very clear. So if you want to wear only pure gold. So unwanted ಇದು ಬೇಡ ಏನಂತಂದ್ರೆ we will use a lot of other stones. ಬೇರೆ stones ಎಲ್ಲ ಬೇಡ. So if you can wear only a good stone ಅಥವಾ ನಿಮ್ ಬೋರ್ಡಿಗೆ ಮ್ಯಾಚ್ ಆಗ್ತಕ್ಕಂಥ ಸ್ಟೋನ್ಸ್ ನ ಯೂಸ್ ಮಾಡಬಹುದು. Okay. So that is the concept behind the Garavisha. Even for Garavisha Shodhana, Acharya told to do Swarna. So that is the concept behind Swarna Prashana. What we are doing is Swarna Prashana, the conceptual understanding of Swarna Prashana. Acharya is advice Swarna Prashana and Garavisha. Okay, if you consume Swarna Prashana, definitely the Garavisha will go out. Ruch Shodhana is advised with Tamra, Raja, and as well as Swarna. One Shana, Swarna is used. Swarna was not used, one Shana. Okay. So these are all the things we should remember. All our rituals, all our traditional practices definitely have some scientific reasons, but we don't know about it. Okay. Doshi we should do, it's a latent poison, so immediately it won't make a poison, it won't affect the body. So the virya of Dushi Visha is not enough to cause a disease. but it will stay in the body and it will wait for a suitable time. Then only it will going to cause a disease or a symptom or a poison effect in the body. That is called as dushisha. Immediately it won't affect the body because of less quantity or less toxic in nature. So it will stay in the body for longer period and it will wait for a suitable condition, suitable period, suitable rutu or suitable conditions. Okay. So I told you DDT story. It's also the so continuous consumption of so and so chemicals for longer days. So definitely it will have an impact on the body health. Okay. So dushisha can also be called as latent poison or denatured poison. Immediately it won't cause any effect on the body. So dushisha is sadhya within a 1 year, is yapya after 1 year, asadhya in kshina, bala vruddha kshina. It is asadhya. Sadhyatva within 1 year, yapya after 1 year, asadhya after 1 year, and as well as if it affects a bala, vruddha, and kshina. So ಇನ್ನೊಂದು practices ಇದೆ. So Kuroda ಇದರಿಂದ, so they will do some black magic and they will put some medicines in the food. So immediately it won't cause any poison effect in the body. But later on, those persons will give up the food and their weight will be reduced. Like that, other toxic symptoms will come after some time. ಅದಕ್ಕೆ ಹಳ್ಳಿ ಕಡೆಯಲ್ಲಿ in villages side they told ಮದ್ದು ಹಾಕಿದ್ದಾರೆ ಊಟದಲ್ಲಿ, they'll put some poison in the food. So those poisons won't act immediately, but later, so it has an impact on the body. It will stay in the gut for longer duration, and it will cause some symptoms. So this is called as dushisha. Okay. So I told you some ajinomoto, like they have some other poisons. For some combination, they have some poisons and that. So for that thing, in folklore, they are giving you omana or viraj. Their track will be there. So after getting some 5 to 10 times of loose motion, or after taking some 3, 4 of womana, so that thing will coming out. That poison will coming out. So that is the concept of dushisha and their treatment modality. Okay. Lushika, Vatapadana, 3 types and 30 number in total according to Sushruta. ವೃಶ್ಚಿಕಗಳು ನ್ಯೂರೋಟಾಕ್ಸಿಕ್ ಅಂತ ಹೇಳಿದ್ರೆ, ಬಟ್ ಇಟ್ಸ್ ಎ ಕಾರ್ಡಿಯಾಕ್ ಪಾಯ್ಸನ್. Neurotoxic cardiac poison. Three types and 30 in number. Okay. Manda 12 in number, Madhya 3, Maha 15. Its Maha is also called as Ugra Visha. Okay. So origin and their Udara, how it will come, and their Parva. So idella just ನೋಡ್ಕೊಳ್ಳಿ, ಇದೆಲ್ಲ ಏನು ಬೇಕಾಗಿಲ್ಲ. Just go through total number of Rustikas and their classification. So Manda 12 in number, Madhya 3 in number, Maha 15 in number. So the Rushika is Vata Pradhana. Vata Pradhana and Takshana, we cannot consider to be a neurotoxic. So Rushika Visha is a cardiac toxic, cardiac poison. neurotoxic word ತೆಗೆದುಕೊಳ್ಳೋಣ. So that's why a severe pain will be there after scorpion sting. There is a severe pain. So in management of the scorpion sting, they will do is blocking, narrow blocking they will do. So in the affected area, and then cardiac activator drug they will use. Cardiac activators. So usually vasopressor excel, like digoxin based drugs they are using. So keep the patient awake and keep the cardiac activity continuously. So that is the line of treatment. In our classics, what are the treatment protocols? Just see. Toxic effect is Tikshna Dhatu Vakini. So Dahyate, just like burning pain, very severe burning and pain will be there with Rushika. Along with the neurological pain, there will be very severe burning, and spreading is definitely an upward spreading only. So all Ruchikas spreading towards above. Here in Asadhya Lakshanas, here very clearly they are given Rut Grahana. Okay, so it's a cardiac poison. Mamsa Patana, Rut Grahana and Mamsa Patana. Asadhya Lakshanas of Ruchika Visha. Chikitsa, so here they are given a lot of treatment protocols. Vatadikya, we should go with the Shita Kriya. So Shita again will provoke Visha. Though it is dominant of Vata, we should not advise Shita Kriya immediately. Okay. So in Charaka Samhita, we are planning with Vata Pitta Hara Chikitsa. So Vata Nashana Kriya is advised in Vagbata. Svedana at the site, Mrudu Upanaha and Mrudu Sveda should be advised at the site of Ushchika Damshana. Tikshna Sveda is contraindicated again. So Abhyanga with Gruta and Saindava is advised. Abhyanga with Gruta and Saindava is advised. Seka with Ushna Dravya Siddha Jala can be encouraged. Sarpi Yukta Bhojana and Maha. So it's better. So Sarpi and Madhu and then Suvarana. It's a universal antidote in Ayurveda. Madhu, Gruta, Kshira, and as well as Suvarana. ನಿಮ್ಗೇನೋ ಸಿಗ್ಲಿಲ್ಲ ಪೇಷಂಟ್ ಏನೋ ಆಗಿದೆ ಅಂದಾಗ ಗಿವ್ ಸರ್ಪಿ ಆರ್ ಮಧು ಆರ್ ಕ್ಷೀರ. In toxicology, we call it as a Kshira as a demicillate. Carrot and Kshira as a demicillate. It will stop absorption of poison into the stomach. Pratisarana with Aridra, Lavana, Trikatu, Shirisha. So Shirisha is a Agraushadhi in Visha. So Aridra, Trikatu, Shirisha, Lepa can be done. Lepa with Tulasi, Manduka Paranirasa and Gomutra. So it can be done easily. We can apply Madhu, Gruta, Kshira with Sharkara Pana can also be advised. Okay. In folklore they will keep some money, Visha money over the bite area. So it will come out very fastly. And then this Manduka Parani Lepa also I have seen in some places. They will put Manduka Parani Aridra Lepa. I have seen in some places Lashuna Aridra Lepa. So they will make Lashuna and Aridra paste and they will apply over the area. And then calcium carbonate stone, Sunna, calcium stones and along with Aridra. So very common folklore practices. And in some places I have seen Neriamedicum, Kanagala, Peru. Then Koda they are applied. So after that I have analyzed why they are using Neriamedicum. So in scorpion poison. So Nerium is a cardiac poison. Nerium is a cardiac poison. So along with the nerium, they will rub the nerium mula with bruta, okay, and apply over there to nullify excess of poison from the nerium, okay. And the beauty of an Ayurveda drug is the poison and antidote will be present in the same drug. Our Ayurveda drugs are complete, except few. Okay, in Sarpaganda is a single drug you can use for hypo as well as hypertension. Serpin and antireserpin is the two alkaloids is present in Sarpaganda. So both will act as a contraindicated to each other. It is present in the old drug. So we don't have any extract policy in our regular routine practice. So alkaloid extract and other things. So our policies is to give a old drug. If we give an old drug, definitely the antidote and poison will be in the same drug only. To nullify excess of poisoning, to reduce the Tikshnata, we can go with purification methods. Okay. So reserpine and antireserpine present in a single herb. Sarpagandha is a drug, you can use it for hypo or hyper, both. It will maintain blood pressure in total. If you use only the extracts, that will give a lot of side effect. Sarpagandha extract is banned. Only Sarpagandha Ganavati or Sarpagandha Churna, Sarpagandha in other form we can advise. Okay. Sarpagandha Ganavati is best. So Gana, they will make Gana by triturating the Kashaya to the original Churna. It's an old drug. It is a more potensified. At least you should do Sapta Bhavanas of Sarpagandha Kashaya over the Sarpagandha Churna. So then it becomes very potensified drug. You can utilize it. Even a 500 mg of Ganavati is equal to 4 grams of Sarpagandha Churna. If you do 7 times Bhavana to Sarpagandha Churna, Sarpagandha Kashaya. It's a very good drug. We can expect very good results in case of hypertension. But treating hypertension is not a simple thing to advise just Sarpagandha, Ashwagandha, some other things. So in hypertension, one thing you need to remember is you need to find it out the etiology of hypertension, whether it is a neurological, whether it is obesity induced, whether it is due to the hyperlipidemia, whether it is due to the renal impairment, kidney issues, whether it is due to the blood vessel issue, any problem with the elasticity of the blood vessel. So essential hypertension after the age of 40 is because of decreased elasticity of blood vessels. Blood vessel elasticity is destroyed after some age because of aging of blood vessels. Okay, so that blood vessel becomes rigid, then automatically blood BP will going to increase. Blood vessels rigidity will increase the blood pressure. Or else stress hormones, so from the brain BP may increase. Any renal impairment, so low clearance of the water content, low clearance of the toxins from the blood, that will also lead to hypertension. So kidney will produce one hormone, renin-angiotensin system. Renin is an hormone produced from the kidney. It will maintain blood pressure in the body. You know about renin-angiotensin system in physiology first year. But we will learn everything in first, second, and third year, but we'll forget during practice. That is the logic behind every practice. So anatomy physiology should not forget till your last breath, till your last day of practice. If you forget anatomy and physiology, so you are no more a doctor. Okay, if you want to become a doctor, if you want to be a doctor, you should continue reading anatomy and physiology every day. At least remember. So this is our anatomy physiology is our bread and butter. Not Kaya Chikitsa, not Roganidan, or no other subjects. If we can able to manage anatomy and physiology, so treatment medicines will come very fast. Okay. So in analysis of hypertension, for hypertension is not a symptom for, it's a symptom only, it's not a disease for us. So it is an outcome at an outburst of some other pathology in the body. So it may be a stress, it may be hyperlipidemia, it may be renal impairment, it may be hepatic impairment, it may be any other problem with the blood vessels. So we need to correct these things, then hypertension automatically will get corrected. If you give medicines for decreasing the blood pressure, it won't solve the pathology. So our Chikitsa Siddhanta is Samprapti Vigatanameva Chikitsa. We should find the Samprapti, where exactly Samprapti started. We should find the pathology. We should not do symptomatic treatment. Lakshanika Chikitsa is not the goal of Ayurveda. Samprapti Vigatanameva Chikitsa and Apunarbhava Chikitsa should be advised. Lakshanika Chikitsa may give you very good bread and butter, but it is not ultimately the line of treatment. Okay. So every disease, even diabetes is not a disease, it is a symptom. So ಏನು ಪ್ರಾಬ್ಲಮ್ ಆಗಿರುತ್ತೆ pathology in the body. So outcome is insulin resistance. Why insulin resistance is there in the body? We need to find out the cause. Okay. So this is about the treatment of Rushika. Rushika, you should remember the classification of Rushika, dosha to dominant, and as well as some important treatment protocol. Remember, it is a Vata predominant and a cardiac poison. So Nerium, you should remember, Nerium indicum is one of the drug of choice in case of Rushika. Next comes Shatapadi. It has 8 types by Sushruta. Just go through it. ಏನಂತ ಕೇಳಿದಾರೆ ಅಂದ್ರೆ Kapila is one of the type of, Chaitra is one of the type of, Shweta is one of the type of. Option ಏನು ಕೊಡ್ತಾರೆ ರುಶ್ಚಿಕ, ಶತಪದಿ, ಮಾಕ್ಷಿಕ, ಮಶಕ, ಗಲಗೋಲಕ. Selected, they may give the option. But the names of Shatapadis are very beautiful. You can remember. So Parusha, Krishna, Chaitra, just like your friends. The names is like your friends' names. ಒಂದೆರಡು ಮೇಲ್ ಒಂದೆರಡು ಫಿಮೇಲ್ ಇದಾವೆ, just note it down. Toxic effect of Shatapadi: Pita, Raga, Shopa, Sweda, Brahma. Okay, so treatment is Atasi Pushpa. Oh, ಇದು symptom Atasi Pushpa Varna Pidaka. So Atasi Pushpa, see the Atasi Pushpa, white color will be there. Atasi. Just go through the picture of Atasi Pushpa and will get to know how the Varna. The Atasi Pushpa Varna Pidaka will be there in Shatapadi. Chikitsa: Lepa with Aridra, Daroridra, Lavana, Gruta. Lepa with Aridra, Daroridra, Gairika and Panashila. Lepa with Kesara, Tagara, Shigru, Padmaka, Aridra, Daroridra. Daroridra is an excellent anti-poisonous drug. And hepatic detoxifier, we can say, Daru Haridra. Hepatic detoxifier, hepatic rejuvenator, anti-poisonous. So according to some research, Daru Haridra is an excellent drug in type 2 diabetes initial stage, where exactly gluconeogenesis and glyconeogenesis will not take place properly. So type 2 diabetes pathology will lay down in liver or in the intestine or in the cells of the body. Okay, because type 2 diabetes is because of insulin resistance. Insulin is not able to penetrate the cell. Insulin is not able to do its function properly. Okay, so in that case, this Daru Haridra, we can expect a very good result in hepatic rejuvenation, hepatic detoxification, in sensitizing insulin activity in the body. So if you want to use a single herbal drug for type 2 diabetes, this is one of the drug Daru Haridra. You can keep in your medicine storage, medicine shelf, this Daru Haridra. Okay, it's a very good anti-poisonous drug. Next, Luta. So mythologically said to be originated from the Sweda of Vasishta. Vasishta Sweda is called as Luta. From there, these Lutas are originated. Number of Lutas, Sushruta 16, Vagbata 28. So types of Lutas according to Vagbata, 3 types: Tikshna, Manda, Avara. So this death time you should note it down. Tikshna, if the Tikshna Luta bites means patient will die within 7 days. Madhyama 10 to 12 days. Avara within 15 days. Okay, so death is fixed with Luta Damskra. But you should remember, even in the shloka of Agada Tantra, so they are given a highlight for Luta. Okay, so it was very clearly given. Agada Tantra Nama, Sarpa, Kita, Luta, Mashaka, Damshta, Vishajanartam, and then Vividha Visha, Samyoga, Upashamanartam. Cha. So in the definition of Agada Tantra only, this Luta was mentioned. So Luta is such a toxic one. Sarpa, Kita, Luta. So it is mentioned very clearly. So you should remember the Luta poison definitely that will very harmful to the body. So very fast means patient will die within 7 days. So Madhyama Visha, patient will die in 10 to 12 days. In Avara, he may die in 15 days. The kind of Vishudha mainly two types, Kruchara Sadhya and Asadhya. So the Kruchara Sadhya is Kaphavata dominant 8 types, Tridoshaja is 8 types. Asadhya is because of Tridoshaja. Name you should remember Shweta, Kapila, Pitaka, ಆಲವಿಷ ಮೂತ್ರವಿಷ ರಕ್ತ ಕರಣ ಅದು ಓದಿದ್ರೆ ನಿಮ್ಗೊಂಥರ ನೇಮ್ಸ್ ಬರುತ್ತೆ ಇದರಲ್ಲಿ ಸೊ ಯು ಕ್ಯಾನ್ ಫಿಕ್ಸ್ ವೆದರ್ ಇಟ್ ಈಸ್ ಎ ಲೂತಾರ್ ವೆದರ್ ಇಟ್ ಈಸ್ ಎ ಕೀಟ ಆರ್ ಶತಪದಿ ಓಕೆ ಸೊ ಜಸ್ಟ್ ರೀಡ್ ದ ನೇಮ್ಸ್ ಒನ್ಸ್ ನೋಟ್ ಡೌನ್ ಸೊ ದೋಷ so just go with it. Vata is Vata predominant. Udvija, how it is Rajin, Udvija, it is Sadhya. Pitta is Agni predominant, Svedaja. And Shukla Paksha, you may live up to 15 days. 15 days you may live. So Kapha is Soma predominant, Andaja. So you may live up to Krishna Paksha. Krishna Paksha. Tridoshaja, immediately you may die. Symptoms of Lutavisha with Vega Kotidare not necessary, but second and third level degree questions you may require. Just read once. ಇಲ್ಲಿ ಮರ್ಮಗ್ನತ ಇದೆ ನೋಡಿ 6th day after biting of the luta 6th day is ಮರ್ಮಗ್ನತ so 4th and 5th days ದೋಷ ಪ್ರಕೋಪತ್ವ 3rd days symptoms clear ಆಗಿ ಕಾಣೋದೇ ಇಲ್ಲ so that you can go with it. Recent days thrombocytopenia, lowering of platelet count, we are thinking about it may be because of dengue and all. So many times it is because of rickettsial infection. So recently, one patient called me. So I have a thrombocytopenia. I advised them to admit. So patient called me on 5th day. So we had been to so and so doctor. He called me on 5th day. There is a decrease in platelet count. So I have count below 40,000. We advised him to admit. In the hospital, the doctor is treating the disease like that of viral fever only. In the hospital, they are telling this is not a dengue infection. This is because of rickettsial infection. And before going to the hospital, it was sepsis, as all over the body there is an infection, and infection leads to the multi organs also. It's called as sepsis, and patient was died after 10 days. So identification and management is bit difficult and different patient to patient. So we need to analyze everything when the patient come to you with the thrombocytopenia. So very less platelet count means not only it will be because of dengue. Many viral fevers platelet count will decreases. In some bacterial fevers also platelet count will decreases. In some other rickettsial infections, also the patient will decreases. And one study, so the study was conducted in Bangalore only. They have taken 1,000 patients of thrombocytopenia. So out of that, only 30 patients will have thrombocytopenia because of dengue. Remaining 20% is because of rickettsial infection, rickets infection, rickettsial infection. So remaining are with other causes, maybe hepatic impairment, some causes. So in hepatic encephalopathy, alcoholic liver disease, platelet count will decreases. In cancer also, platelet count will decreases. So many other symptoms are possibilities for there. But these two are the main things, the viral fever, especially the dengue viral fever, and as well as rickettsial infection. Okay. Just go with Asadya Luta and Sita Fishadishtana. So Vagbata told it is a Shwasa. Dumpster especially found in Mukha, Mala, Mutra, Shukra, everywhere there is a poison in Luta. Luta ಮುಟ್ಟದ ಕಡೆ ಎಲ್ಲ ಇದ್ದೇ ಇರುತ್ತೆ. ಚಿಕಿತ್ಸಾ ಫಾರ್ ಲೂತ ವಿಷ. So Luta Vishopakrama, there are 10 Vishopakramas is there. So this thing we should note down. Dasha Vishopakrama is advised in. Dasha Vishopakrama is advised in Luta Visha. Chaturvimshati, 24 Vishopakramas for Jangam Charaka. Chaturvimshati, Jangam for Charaka. Dasha Vishopakramas advice for Luta Visha. So, especially Dasha Vishopakramas are Nasya, Anjana, Benga, Pana, Dhumapana, Opidana Nasya, Kavalagraha, Vamana, Virechana, and Ratna Moksha. So, just note it down. So, what are Dasha Vishwapakramas in Luta? Question may come like that, which among the following is not belongs to Dasha Vishwapakrama of Luta Visha? Okay. So, ಆತರ ಬೇಕಾದ್ರೆ question ಬರ್ಬೋದು. Just go with it. So, and then treatment modalities, Chedana with Ruddhapatra Shastra. So, just go through it. Shleshmantaka Tvak is specifically for Luta Visha. So, Luta do almost now Nodilla in recent days. Practically, these things are not important. But for AAPGD purpose, you must know Shleshmantaka Tvakchona is used. Vabadacharya has mentioned Shleshmantaka, Akshata, Padmaka Yoga, Champaka Yoga, Mandala Yoga. Aha, this is very important. So the names of flowers, Champaka, Padmaka, Mandara Yogas. These yogas are advised in Luta Isha. Shleshmantaka Tvak is used here. Nilinyadi Grutant Kasha is also used in Luta. Okay. So the names of Agada is like that of Akshaka Agada, Padaka Agada, Champaka Agada, Mandara Agada. The flowers names is there. Flower name Agada Vantantadra, it is indicated for Luta Visha. That you should remember. So Shleshmantaka, Akshata, Padmaka, Champaka, Mandara. Ludra Sevia, the Agada is one of the Agada used here. Nili Daladi Kashaya, Nili Tulasiadi Kashaya, Nilinyadi Kashaya. It is used for Luta Visha. Lepa with Aridra, Mandishta, Patranga, Naha Kesara, Daru Aridra. Common. Vishara Dravya, Lepa can be advised. Lepa with Chandana, Lepa with Shvetaparanava, Lepa with Apamarga. But in Navanita use Madara, butter is used. That you should remember. Okay. So when it comes to Lutha Visha, you should remember Lutha's Adhishtanas, Lutha types, and death occurs in Lutha within 7 days, within 14 days.